Hello there. Welcome to the foot and ankle preoperative education video. My name is Alex. I am one of the PAs that works for the foot and ankle service. On behalf of the entire foot and ankle team, we want to thank you for choosing Michigan Medicine Department of Orthopedic Surgery for your foot and ankle surgical needs. We hope this video is very informative and helpful in preparing you for your upcoming surgery. The goals of this presentation are to prepare you for surgery and to provide a resource for you to be able to reference back to. The outline is as follows. First, we're going to go over some points to answer the question, am I ready for surgery? Next, we'll go over logistics of surgery. Then we'll go over some general preoperative education points, including how to manage home medications. And lastly, we'll go over foot and ankle specific postoperative instructions. It is required to watch this video in its entirety prior to your pre-op appointment. Please remember to click the link found in the description of this video below to test that you have watched this video for our records. It is a good idea at this time to have a pen and paper nearby to write down any reminders or questions you may have or a to-do list for yourself. The foot picture to the right can be found throughout the presentation and is a reminder to bring that item to your appointment. Please arrive on time to your pre-op appointment, which is 15 minutes before the appointment time to allow for proper check-in and rooming. The following are some considerations to make sure you have optimized yourself for a successful surgical outcome. First, have you seen your family doctor within the year to have chronic medical conditions checked up on or bring forth other new medical concerns you may have? For our patients with diabetes, it is important to maintain strict blood sugar control. Your hemoglobin A1C should ideally be less than 7.5 unless given a different value by your surgeon. Unfortunately, bacteria loves sugar, thus really high blood sugar brings a risk of infection and wound issues after surgery. Stop all nicotine products 4 to 6 weeks before surgery and for about 3 months after surgery. Now, this includes everything listed in the red box to the right, such as cigarettes, cigars, chewing tobacco, vaping, nicotine patches, nicotine gum, and really any other products that may contain nicotine. Nicotine impairs blood flow, which brings a risk of wound complications and delayed bone healing. We need to make sure you have a good, healthy diet for a body healing from surgery, and that your body weight is optimized on an individual basis. Medical clearances requested by our surgeon should be received and reviewed by our office. With your help, we should have a plan in place from your other healthcare providers regarding special medications you may be on, including blood thinners, rheumatologic medications, immunosuppressants, chronic pain medications, etc. Social support is very important after surgery. You need friends or family to help or at least be available to help if needed for the first 1 or 2 weeks after surgery. You must have reliable rides to and from surgery and post-op appointments. You need to enlist friends or family if needed, or even insurance-covered rides. Our guest assistance program has social workers that can help with transportation needs. Our patients are expected to make post-op appointments even if coming from far away. If you do feel there are some unchecked boxes for you, please let us know so that we can coordinate help or delay your surgery to a better time. Logistics. You will be given your surgery date, location, and time by our surgery scheduling team and confirmed at your pre-op appointment. We perform surgery at several different outpatient locations and at the main university hospital, depending on the type of the surgery, your medical conditions, and if we need you to stay a few days in the hospital afterwards. Whether your surgery is outpatient or inpatient depends on many factors. The picture at the right is an example of a page in the pre-op booklet we will provide you at your pre-op appointment. It has helpful information about the location you are having surgery at, including address, parking, and check-in info. It also has blank spaces that we will fill in at your pre-op appointment. Time of surgery is subject to change, but will be confirmed by the surgical center several business days before. We generally ask that you arrive 2 hours before your scheduled time. A responsible adult companion, age 18 years or older, must drive you to your surgery and take you home. Taking a bus, cab, Uber, or insurance-paid transportation is not allowed unless your responsible adult companion is with you. We require a COVID test within 96 hours of surgery, regardless of your vaccination status. This should be arranged for you. The next few slides will contain some general pre-op education. The information will be written down for you in the pre-op booklet that we will give you at your pre-op appointment. We are going to cover the most important points on the next few slides. Do not eat or drink most liquids after midnight the night before your surgery. If your surgery is later in the afternoon, then the pre-op nurses may give you a different time, but in general, midnight the night before your surgery is the cutoff point. This includes small things, so even no gum, mints, or candy. You can have small sips of water if needed for medications, and we will go more into which medications are safe to take or not in the slides ahead. Water and other clear liquids are allowed up to 4 hours before surgery. Do not drink any alcohol 24 hours before surgery. On the night before, in the morning of your surgery, take a shower using antibacterial soap such as Dial or Safeguard. After your shower on the day of surgery, do not put anything on your skin or hair. Avoid application of any makeup, lotion, perfume, powder, hairspray, or deodorant, antiperspirant. Brush your teeth. Take off nail polish and artificial nails as we monitor blood flow through the fingertips. Wear comfortable, loose-fitting clothing that is easy to put on and take off. Do not shave or use hair removal products around the surgical site for at least 3 days before surgery to avoid irritating the skin and causing any possible infection. On the day of surgery, wear your eyeglasses, hearing aids, and/or dentures. Please bring a case, however, to store them in while you're in the operating room. Do not wear contact lenses on the day of surgery. Do not bring any valuables, such as jewelry or money, with you to the hospital on the day of your surgery. Remove all jewelry prior to coming to the hospital, including earrings, watches, wedding bands, hair clips, and body piercings. Bring a list of your home medications to review with the pre-op nurse who checks you in. You do not need to bring your actual home medications with you. If you are admitted to the hospital after surgery, your current medications will be provided by the hospital. Bring inhalers and/or any CPAP or BiPAP machines, if you use them, with you the day of surgery. It is super important to make sure your medication list in our system is up to date. This includes all prescription medications, prescription pain medications, over-the-counter medications, even vitamins, supplements, herbals, etc. It is a good idea to bring a list of all the medications to your pre-op appointment at our clinic so it can be confirmed by our medical assistant staff when you are being roomed. Stop all homeopathic, natural supplements, any fish oil or vitamin E products at least 1 week prior to surgery. Do not take any vitamins or minerals the day of surgery. Stop taking anti-inflammatories or NSAIDs such as Motrin, Advil, ibuprofen, Aleve, naproxen, Mobic 1 week before surgery. Work with us to get medical clearance from your other healthcare providers to stop taking prescription blood thinners, such as those listed below. However, do not stop on your own. Some need to be stopped as soon as 1 week before surgery, so we do need to plan ahead. However, do not stop until given the okay beforehand. If you take aspirin, we will guide you as to when to stop it before surgery. Again, do not stop on your own. Chronic pain medications should be managed by the prescribing providers or pain specialists. It is your responsibility to discuss a plan with them prior to surgery, as we cannot have you filling prescriptions for multiple pain medications. Unfortunately, you will run into insurance complications, and it's also just not safe. So we need to plan ahead. If on steroids or other rheumatologic medications, we also may need to stop those. Please reach out to your rheumatology team for recommendations, and we're going to reach out as well. Regarding all other medications, we will direct you on those. Next, we're going to switch gears and start to talk about what to expect for after surgery. So we're going to go over foot and ankle specific post-op instructions. You will be given the foot and ankle post-op instruction sheet at your pre-op appointment, and this will include all the information we're about to cover. That information is also available on the Patient Clearinghouse website. You can type in the search box foot and ankle and you should be able to find it. First topic we'll talk about is the dressing. Bleeding through the dressings is common. This usually occurs the first 1 to 2 hours after surgery. The actual bleeding usually has stopped by the time you see the drainage through your dressings. All of the dressings will be changed by us. You do not need to change your own dressing unless we specifically tell you to do so. Your dressings will be changed by us at the first post-op visit. Your only job is to keep the dressings nice and clean and dry at all times. Do not shower, bathe, or wet your dressing in any way. You can either purchase a cast bag or use a garbage bag to cover the dressings that you have, or you can sponge bathe. Here are some examples of dressings that we commonly use. The first picture is of a short leg splint. The second picture is of a cam boot. And the third picture is of a post-op shoe. Either way, whatever dressing you are sent home in, your job is to keep it on and intact and dry. Elevation is super important after surgery. It's important to keep the tension off of the healing incisions and also to reduce that throbbing, aching pain that you may experience after surgery. Elevation is super important for the first 2 weeks. Elevate your foot or ankle above the level of your heart, or at least at waist level if unable to elevate above the heart. The more you elevate your foot and ankle, the less pain you will have. You can take breaks from elevating for 10 minutes or less at a time. After the strict elevation period is completed for those first 2 weeks, you may gradually become more active and get up more, but please pay attention to your foot or ankle so that you know when to lie down and elevate again. Here's an illustration to give you an idea of the best way to control swelling after surgery. Most patients will set up themselves either in bed or on a couch and build a ramp of pillows all the way from their foot to their hip. And it's important to elevate above the level of your heart and also make sure that your heel is floating so that there's not too much pressure leading to pressure sores on the heel. Weight-bearing status after surgery largely depends on what type of surgery you have done, so we will clarify this at your pre-op appointment. Below are some phrases you may see and definitions of what they mean. Weight bear is tolerated means that you may fully bear weight on that surgical side as your pain allows. Heel weight bear means that you may place weight but only through your heel. Non-weight bearing means absolutely no weight on the surgical side. This means that the foot may not even touch the ground while standing or walking. Weight bear for transfers only is the same as non-weight bearing, except that you can place weight on the surgical side when needing to pivot to bed or to the toilet or for balance, but otherwise you are non-weight bearing. Prescriptions for mobility devices will be provided at your pre-op appointment. Options include crutches, walker, or a knee scooter. You can then fill the prescription in any medical equipment supply store. Please bring the fax number of the store that you're going to be sending the script to your pre-op appointment. Some have delivery options. Your insurance determines what is covered. Knee scooter coverage is hit or miss, but you can purchase online, rent from a store, or even borrow from a friend. If you have never used crutches before, there is a great resource at the myufmhealth.org account. You can use the code G273 in the search box to bring up literature on how to use crutches. Prepare your home with clear pathways. It is best to have a first floor bedroom. If you do have stairs in your home and you have a non-weight bearing status, you will need to go up and down the stairs on your bottom. Please make sure to bring crutches, walker, or the knee scooter with you the day of surgery. After surgery, we want to protect you against developing blood clots. Our go-to regimen is an 81 milligram aspirin twice daily. That is 1 tablet in the morning and 1 tablet in the evening, starting the first day after surgery and continuing until you are walking out of a cast or boot. The goal of this is to reduce your risk of developing a blood clot in the leg. A blood clot is also known as a deep venous thrombosis, or abbreviated DVT. If you have a personal or family history of blood clots, whether that be in the legs or in the lungs, please let us know, as we will likely use an alternative to aspirin for blood clot prevention after surgery. Next, we'll talk about how to manage pain after surgery. Expect to have some level of pain after surgery. This is normal and part of the healing process. Everyone feels pain differently. Our goal is to help make sure that your pain is more tolerable. Studies have shown that surgical pain can be managed by alternating non-opioid pain medications such as Tylenol and ibuprofen. Our typical regimen is 1,000 milligrams every 8 hours of extra strength Tylenol. Continue this regimen while you still have pain. Remember that some opioid medications have acetaminophen in them. Consider this when deciding how much acetaminophen to take. Do not take more than 3,000 milligrams of acetaminophen in a 24-hour period. Motrin or ibuprofen is another option. When you are met at your pre-op appointment, we will let you know if this is an okay option for you to add in. You can take up to 600 milligrams every 6 to 8 hours and alternate this with acetaminophen. Do not take more than 3,200 milligrams in 24 hours. Do not take ibuprofen if we have specifically told you not to. And there are certain surgeries where we don't like our patients to take ibuprofen for pain management after surgery. Consult with your primary care doctor before taking if you are on blood thinners, have a history of heart disease, severe kidney disease, bariatric surgery, or stomach ulcers. You will receive a prescription for a small amount of opioid pain medication. You may use the opioid for severe pain in the first 24 hours after surgery. After that, only take if absolutely needed. We recommend that you are off opioids within 2 weeks of surgery. The 3 options for opioids that we typically use are oxycodone, hydrocodone acetaminophen, also known as Norco, or tramadol. Of note, Norco has Tylenol already in it. The morning of surgery, the anesthesia team may offer you options for a nerve block or nerve catheter. These are additional ways to get better pain control after surgery. A nerve block is when the anesthesia team finds the nerves that start higher up in your leg that bring feeling and sensation to your foot and ankle. They find the nerves and put some numbing medicine near them. A single shot nerve block has good pain relief, but it can be variable, lasting anywhere from 4 to 24 hours. During that time, that means that you will have numbness, tingling, and lack of movement in your foot. You will have pain as the block begins to wear off. Know this and start pain meds before the block wears off. It's recommended to take your first dose of the prescribed pain medications 2 to 4 hours after getting home. Take them until the block wears off, then only as needed. A nerve catheter is where they do a similar procedure, except they leave some tubing in and you get sent home with some numbing medication hooked up to a bulb that goes through the catheter they leave in place. The acute pain service team who places the nerve catheter will typically call to check in on you on the days after surgery while you still have the catheter in place. With this, it is recommended to take the opioid pain medication and acetaminophen on a schedule for the first 24 hours. After that, only take the opioid as needed for severe pain, even though the catheter is still in place. Continue acetaminophen while you have pain. If you think you may need a refill on medications, call before you run out, as refills can take up to 24 hours to process by our clinic. We run a MAPS report with every refill, which means we are able to see when and where you have filled other opioid prescriptions. If we feel you are using pain medications inappropriately, we do have the right to stop giving you refills. Please do not use the after-hours number for pain medication refills. It is designed for urgent needs only. Plan accordingly and anticipate if you may need more. Please do not wait until Friday afternoon to call for medication refills. If you have more than 6 weeks of surgery, we do not provide pain medication refills. This is department policy. It is our goal to wean you from pain medications much earlier than this. This is a picture of the Start Talking form, which we will have you sign when we see you in clinic. We will go over the risks and how to use opioid pain medications appropriately and safely. Unfortunately, some patients have issues with nausea from the pain medications or itchiness from the dressings we place on them. If that's the case, we use hydroxyzine, which works as an anti-nausea, anti-itch medication. It's similar to Benadryl in that it can make you a little sleepy. How to take it is 1 tablet every 6 hours as needed. If you know you are sensitive to opioids, then it's a good idea to take 1 tablet 30 minutes before you take that opioid. If we do a surgery that involves a lot of bony work, we will recommend the following for bone health. That includes vitamin C, vitamin D3, and calcium. For constipation prevention, it's important to keep hydrated. If you are constipated, it's recommended to take an over-the-counter stool softener, such as Colace or Miralax. If you tend to get constipated, take it as a prevention. Stop the over-the-counter stool softener once you are having regular bowel movements, and certainly stop if you are having diarrhea. When should I call for help? Contact the office if you are having any of the symptoms below. Severe swelling or pain in the leg or calf. This could indicate a deep vein thrombosis or the blood clots we previously talked about. Heavy bleeding that soaks through your dressing and increases in size. Blue or white toes. This indicates a lack of blood flow to the foot. Your toes may look blue if you dangle them, but this should improve with elevation, and if it does not, please let us know. Fever greater than 101.5 degrees Fahrenheit. Fevers less than this, or low-grade fevers, are very common the first few days after surgery and are unlikely to mean you have an infection. Remember to take deep breaths every hour, especially until you are more mobile. And lastly, severe pain that does not improve after pain medication. This slide has 2 important numbers. The first number is our Monday through Friday, 8 a.m. to 4:30 p.m. call number for any questions or concerns. The second number is for weekends or evenings. You ask them to page the orthopedic resident on call if you have questions or concerns. If you're unable to reach anyone or feel you have a medical emergency, please go to the nearest emergency department. Again, it is a reminder that medications will take up to 24 hours to be refilled by our office. Appointments. If able, we arrange a video visit appointment a few days after surgery to check in. You are seen in clinic for your first post-op appointment within 1 to 2 weeks after surgery. Sutures or staples are usually taken out at week 2. X-rays, if needed, are usually taken at week 2 as well. Then we typically have a 6-week post-op appointment and then a 12-week post-op appointment. If you need to reschedule any of your pre-op or post-op appointments, you must contact our surgery scheduling team to ensure you are properly scheduled. Physical therapy is determined on an individual basis, dependent on what surgery you had, as well as what activities you are trying to get back to after surgery. Regarding work absence or FMLA paperwork, the amount of time off is determined again on an individual basis. Please bring your paperwork to the pre-op appointment so we can have our special team that fills out that paperwork get going on it. Temporary handicap parking paperwork is available if deemed appropriate depending on the surgery. All right, that brings us to the end of the presentation. I know it's a lot of information thrown at you all at once. Luckily, you can always go back and watch this video over again. If you do have any questions that you wrote down, please bring them to your pre-op appointment, as well as the other items that were mentioned throughout the presentation. We will fill in the blanks and go over timelines very specific to your surgery. Please expect to sign a consent at your pre-op appointment, and then we usually provide prescriptions as well at the pre-op appointment. We look forward to seeing you in clinic soon.